Hello everyone, this is Dr. Sainath, consultant neonatologist and pediatrician from Cloudline Hospital, Vattur Road Branch, Bangalore. Sudden breathing difficulty in children is a medical emergency and immediate attention is required to prevent complications and often sudden death. So there are 5 common reasons for sudden breathing difficulty in children. First is foreign body ingestion. Any foreign body can obstruct the baby's airway and cause choking to the baby. Second one, allergy or anaphylaxis reaction to any of the food, pollen, insect bite, etc. Third is asthma. Fourth, epiglottitis. It's an infection of the epiglottis which can lead to stridor. And fifth is pneumonia. How parents can react when they notice sudden breathing difficulty in children? First, check your child can breathe or cry and observe the breathing. Second, ensure baby is in comfortable position, preferably sitting. Ensure there is no tight collar around the neck. Remove if any tight collar. Fourth, do not give anything to eat or drink. And 5, if any known condition is known such as asthma, keep inhalers nearby. 6, call for the medical emergencies and reach out to hospital as soon as possible.